Let's do some core work. We're going to learn an exercise called the dead bug, but in order to do that, we first need to learn how to activate our core and how to brace, and that starts with something called the posterior pelvic tilt. So come to lie down on your back, knees bent, feet planted on the floor. You can bring your hands to your belly or to your hips, wherever feels like a more natural place for your hands to rest, anywhere that you can kind of feel movement of your pelvis. So most of us end up commonly sitting in a forward or an anterior tilt of our pelvis. What we're looking for with activating our core is starting with this backwards or posterior tilt of the pelvis. And what you're looking for is to feel this natural curve of your low back flatten and make contact with the ground. Now, we're not trying to round and really crunch ourselves backwards. This movement is really coming from the pelvis. And a cue that I like to use to help people activate their core and initiate this movement is like you are going to cough, and that kind of bracing feeling is what you're looking for with your core. So the posterior pelvic tilt, the points of your hips, the pointy bones at the front, are going to roll backwards towards your rib cage, and then you should kind of feel this like bracing, vacuuming pressure sensation around your core. This might be a lot of work just to hang out here and to try to breathe. So with this posterior tilt of the pelvis and the contact of the low back with the ground, now your hands come to your belly and you're going to take a deep breath in, keeping all of that engagement, and deep breath out. And you might stay here and this can be your core work. This is very difficult, especially if you've never done it before. So that's step one. That's the posterior pelvic tilt and the core engagement. The dead bug would be the next stage. So what we would do is bring one or both knees over top of our hips, and right away what you might feel is that you've lost that tilt of your pelvis and now your low back is not making contact with the floor anymore. So re-engage that bracing feeling like you're going to cough and the backwards roll of the pelvis so that we're flattening in the low back. And again, you might find that this is enough work. There's a lot of value to staying here, keeping this activation, and taking a couple of deep breaths. If you're staying, take 3 breaths, lower one and then the other leg, relax, and repeat a couple of times. If you're ready for more, the final stage with the dead bug would be all of the same things: the posterior tilt of the pelvis, lifting the knees up over the hips, engagement through the core, contact with the low back. Arms are going to come up over top of the shoulders. Opposite arm and leg are going to reach away from the body and then back towards center. The arm and leg that aren't moving are not moving. So we're not doing this. There's no momentum involved. And part of the movement is keeping the stability of your non-moving arm and leg. Now, your arm and leg are only moving as far as you can still keep control and contact of your low back. If when I go to reach my leg, my back lifts too far, we're just going to hang out here and practice that breathing and the engagement through the core. And that's the dead bug.